Well, it's a great honor to host Dr. Bryen Bell, a renowned chiropractor, this morning. Thank you for joining us, Dr. Bell. I know you have a busy schedule. Thank you for joining us.
And Dr. Miriam, thank you for having me. Absolutely.
You're welcome. Well, thank you for coming back to the beautiful Pacific Northwest. I understand that prior to coming back to Oregon, which is your home, you built quite a bit of a reputation in Beverly Hills, location that you had, because you were seeing numerous Hollywood elites and professional athletes. Dr. Bell was featured in Fine Living, the Style Network, and the TLC Cable Network, and has been recognized as a wellness specialist. That is very amazing to me. And please tell us more about your approach. I was really impressed with your bio and what a multidisciplinary and holistic approach you have to care, which really resonates with what we do with dentistry too. So please tell us more about yourself and the care that you give your patients.
Yeah, absolutely. So I am originally from Los Angeles, born and raised in Pasadena. Went to school in Los Angeles. My wife and I opened up a practice in Beverly Hills and Brentwood. We practiced in Beverly Hills for about 10 years, moved it over to Brentwood, and then decided that enough was enough. We had some stuff going on with our kids. We had some allergy issues. So it was time for us to just leave. So we moved here to Oregon. We settled in the amazing town of Beaverton. We love it out here. And I have, since I've started practice, I have been what's called a corrective care chiropractor. There's chiropractors, our profession is a pretty amazing profession because we've got a lot of great people doing a lot of great things, but at the same time in our profession, a lot of people get confused as to what we do, because when you go to a chiropractor, a lot of times we get different things. And so one of my specialties is in what's called corrective care. And what that means is we show before and after X-rays, so we can actually make physical, mechanical changes, not based on how somebody looks or feels, which is quite common in our profession, right? And it's important to get somebody out of pain, but also to make those changes that we can see in black and white with actual measurements, and literally biomarker data, just like a blood pressure is a biomarker, right? Blood tests are biomarkers. So we use X-rays, and the reason why we love using X-rays is because across the board, you could go to, I don't know, across the country to another country, Spain, right? The doctors in Spain will read X-rays the same way we read X-rays. So across the board, doctors understand what we do, and patients can see those results. And so we get to actually make those changes and go beyond the pain, so to speak, and correct what's going on inside, where the spine and the nervous system lives, breathes, and sleeps, right? We know that the spinal cord is inside the back, which is why it's so important to make sure that, aside from just back pain, neck pain, headaches, that the spine is also healthy. And so that's why we like to go beyond the pain, so we can actually fix and solve problems so people don't keep living with them, and we're not just dangling a carrot in front of them and saying, hey, we got you out of back pain, come back in when it hurts again, and then a week later they're back in, and we're just doing this yo-yo cycle that isn't really serving that person. Mm-hmm. And so that's why I became a corrective chiropractor, and I kind of in the very, very beginning maybe stumbled on it a little bit because we were taking X-rays, but we weren't really doing the post X-rays. And so somebody would get into a car accident, and as during the course of care, I would take another film, and then I would look at the two films and go, holy cow, yeah, the person just got into a car accident, but their films are so much better now, like the curve in the spine, the alignment. And so I kind of stumbled on it, at knowing, not knowing how good our technique was working and how much change we could actually make. Because quite frankly, this is not taught in chiropractic school, like how to actually correct, but chiropractic works so well that we can correct.
That is very interesting because, like, for example, in dentistry, taking X-rays is a standard of care. You have to take an X-ray to identify pathology and then fix the problem, but it's not a standard of care that they teach at chiropractic school?
Chiropractic. Well, X-rays are a standard of care. However, post X-rays are not.
Oh, post X-rays. Okay.
Post X-rays are not something that is taught.
Okay.
Only because there are so many different techniques that are out there, and a lot of the techniques just don't really produce those type of results.
Okay.
Yeah. So we just like to shoot the post films to see where we're at and take a look. And, you know, we know nowadays that X-rays, I mean, you know this, Doc, X-rays are safe. They've been shown and proven. The Journal of Nuclear Medicine just came out with some new stuff disproving all the theories of how radiation is very, very harmful. Well, all that's been disproven, the theories that came from World War II and the Hiroshima bomb. So we know that X-rays, although it is ionizing radiation, and we do them very conservatively, we know that they're also very, very safe. And it's a pretty fantastic tool in evaluating what's actually going on inside. And again, just going beyond back pain, neck pain, headaches.
So depending on the patient and the
problems.
case, you come up with a treatment plan. You'll say, I need about 3 months, you know, every week or every 2 weeks to see you. And you kind of like project that. And then at the end of the treatment,
Correct.
You'll go ahead and follow up with X-rays and compare.
Correct. We'll compare, see how well that person performed, which is also dependent on, you know, we have what's called a 50-50 rule in our office, which literally means, hey, you do your 50, I do my 50. And that's going to include some home exercises, some typical corrective exercises that we do here in our office, including traction and neuromuscular reeducation and strength exercises as well. But really the process is with time and repetition, creating the alignment, just like we create alignment with braces, right? There is no, there's no, you know, braces that you could put on, crank down and make your teeth do this in one shot, right? Chiropractic works very similarly. May not be my best analogy, but it's the best analogy that I have. With time and repetition, we make those changes, and then we can show them on the biomarkers. And all those changes, we've got some great samples of changes that we've made that you can actually see on our website.
I really like your approach, and I was really impressed with the facility that you have. You know,
Thank you.
You're not just correcting the alignment, but then you are also establishing that neuromuscular. You're basically reprogramming, establishing new neuromuscular programming by giving
Right.
patients training and exercises. So you expect your patients to follow up, you know, to keep up, do their 50%, as you mentioned,
Absolutely.
by doing their stretches and strengthening exercises. And I was very impressed with the area that you had in your office to make that happen.
Yeah, we've dedicated like specific areas in our office to make that happen, because we know, like in my 20 years of doing this, we know that if you give patients home care exercises, you know, everybody's busy, everybody has things to do, and you know, a lot of times it just doesn't happen. People don't do them. So it's not that we're bad people, it's just that we're busy people. And so we make sure that when they come in, they're also doing those while they're here, so that number one, it gets done, right? And there's no excuses. But also number two, they get done in a safe environment and they're supervised. So if they don't do them correctly, we know, and we can correct them because we've got eyes on them, and we make sure, you know, and I've got a team here that's also looking at them along with my associate doc, myself. So it gets done, and it just increases our results to show on that X-ray biomarker, so that we can make those changes and make the changes that the patient expects, right? And there's just no excuses anymore. It's just get it done. So.
I was very impressed with your dreams approach. Please tell us more about dreams.
So this is something I came up with. It's our holistic approach to really, I mean, after corrective care, there's going to be more of a what's called supportive care. You can also call it maintenance care, but I really don't like the word maintenance, because maintenance suggests that things are just static, and you know, our lives, our bodies are not static. So really, the best word for it is wellness care, and we need to make sure that we're eating right, we're moving right, we're sleeping well. And so DREAMS is an acronym for diet, rest, exercise, alignment, mindset, and stress management. And the alignment portion is what we specifically work on, because these are laws of the body that we're addressing, not just, good ideas or good concepts. These are little, you got to eat good. You've got to move well and exercise. I mean, I can't sweat for them. They have to sweat themselves. Right. So, so once the best correction has been achieved, we move that patient into wellness, making sure that they don't go back to where they were before, but also help them with those aspects of life and sleeping better and all that stuff. And we've noticed that, if you take care of the nervous system, it is the primary operating system in the body, which controls everything, including the heart and the blood. You take care of that system, the central nervous system inside your back, and you're going to sleep better. You're going to feel like moving better and exercising. And then after that, you're going to feel like, you know what, I need to eat better. Right. And so it all starts with making sure that alignment portion, the spine and nervous system, is getting addressed. And then what I've noticed is that naturally people move themselves into those categories, and we start addressing all those. And the last one, the S on dreams, which is stress management. We're also stressed. We live in a very stressful society. Those stressful environmental or whatever they are conditions, our bodies will handle better, right? We can't solve those problems for them. We know that we're all solving our own problems. But when you have your health, when you're sleeping better and you're thinking better and you're more positive and you're eating better and you're moving, I mean, life is better,
Yes.
and we can handle life better. And so those are essentially the goals. And the dreams lifestyle we introduced definitely later on. And I don't always X-ray my patients every single time they come in. So we move our patients into other types of biomarker evaluations. And what the test that we like to use is called HRV, which stands for heart rate variability. And we actually use specific heart rate variability monitors. Like this is a finger monitor that's specific for where's my camera, for HRV. And there's a ton of really cool science and research on backing what heart rate variability is and how it relates to longevity and stress and readiness for the day and productivity. And there's even a ton of research on chiropractic and HRV, because it's all connected. It's a stress test on the heart. And what's connected is that the brain tells the heart how to work through the spine. There's no other way, right? So that's why there's a lot of great research on chiropractic and HRV. So yeah, so we move people through that and test them and make recommendations, again, based on this biomarker data, so that we don't have to keep X-raying. But it's been a really, really wonderful tool, and we're able to really help a lot of people.
You mentioned some really key words, connection, and how this is all connected, and
Yep.
And as a TMD provider, I see patients in pain all the time.
Yep.
And, there's much debate in the dental world whether or not TMJ problems are psychosomatic or somatopsychic. And it's all related. If somebody has poor diet, they're going to end up mouth breathing. They can change the orthopedics of their head and neck. If they have inflammation in their nasal cavities or sinuses, or they have big tonsils and adenoids, obviously the posture of the head and neck is going to change, which affects malocclusion. Malocclusion is just basically posture of the teeth and the alignment of the upper and lower jaw. And so if these patients have poor nutrition, they cannot sleep very well, and they end up grinding and clenching because they're trying to open up their airway. On the other hand, if they can be under stress, from something in their life, and not just their body, but mentally be under stress too, and then we can see it manifesting in the physical in body, and we can see the breakdown of the body. So that's so important that you have this holistic approach. And after taking care of their primary pain and concern, after taking care of that acute problem, then you try to set the foundation for longevity and for long-term health. And
Right.
I'm really impressed with that, because that's unfortunately what's missing in our medicine these days. We have all these specialties and subspecialties, and a lot of patients just end up going to 10 different doctors. None of these doctors are communicating with each other. And,
Right.
so it's a great approach that you have.
Thank you.
That's why you're so successful. So tell us about the importance of chiropractic alignment in athletes, and why is it important to have the head and neck aligned, especially in athletes?
Well, especially in athletes. When you talk about everyday athletes, right? Brain tells the body how to work. It's got to go through. It starts with the neck. It's the nervous system is inside the spine, so that system has to be aligned correctly in order for the body to function. But in athletes, we know that the nervous system is controlling balance, speed, coordination, agility, strength, and that's what the nervous system does, right? So we need to make sure that that system is working appropriately. And when it comes to athletes and what we do to our bodies as athletes, we know that the science and the literature shows that traumatic events causes a shifting of bones to be literally out of place in the spine. The University of Yale did some studies. They have pioneered studies in the past in car crashes, and they study trauma. Now they can't study people, falling down stairs. They don't study people slipping on ice. What they study is people in car crashes, and they found that people in car crashes, it's an 8.2 mile an hour car crash. The studies show that 8.2 was the number, was enough to actually tear ligaments, injure body parts, and knock things out of place. They're called subluxations. And subluxations are bones that literally shift out of place. A jaw could be, subluxated. That's going to cause a TMD issue. A shoulder could be subluxated. A knee could be subluxated. But when it happens in the spine, that's where it affects that nervous system. And so that's one of the things that we do. That's our primary goal, is to search for subluxations if that patient has those problems, because if they are there, they cause the spine to degenerate. And it's a lot like a cavity in a tooth. If it's just left alone, because we can't see cavities, a subluxation in the spine gets left alone, it literally will melt and rot the spine, just like a cavity melt and rots the tooth. And it's really super common. So we look at this, we look at the X-rays, and we look at degenerative patterns as well. And we're able to put people kind of on a category of where they probably are and how long they've had their problem or their subluxation, so that we can determine how to actually correct that problem. And it makes sense for that particular person, for that particular case. So yeah, we do see a lot of that, especially with the athletes, just because athletes are, we're pushing our limits. And a lot of athletics do involve trauma and impact. And one of our other specialties is concussions. So it's important that a concussion gets addressed with nerve supply in the neck, not just the head. And so we can talk about that later. But as far as athletes are concerned, it's a really, really big thing.
I recently had a patient referred to me for his TMJ and bite, and I referred him to you. So he's an athlete. He plays lacrosse professionally. He's probably about 18 and ready to go to college. And the reason he was referred to me is because he was in braces for about 5-6 years. And the orthodontist had a really hard time meshing his teeth and aligning the teeth together. She could bring the molars together, but all the bicuspids and front teeth were out of alignment. It was like almost an open bite. So the first thing that I do when I get a TMJ patient is look at their posture. And when I looked at him, he had quite a bit of craniosacral malalignment. His eyes were canted, shoulders were canted, and hips were canted. Now, this is a big guy. I had to step on the stepping stool to be able to see his posture. But I saw that right away. And then I looked at his side profile, and he had a forward head posture. I only had 3 weeks because he was going to college, so I couldn't really start my protocol on TMJ treatment. But it was amazing to me that when I sent him to you, I think, how many appointments did you see that patient?
Gosh, I think we did 4 or 5 appointments.
4 or 5 appointments. And after the 4 or 5 appointments, in a matter of 2 weeks, he came to me, and his bite was almost closed. So I saw firsthand the impact of his just neck alignment. I'm sure you didn't touch his bite, But what this orthodontist struggled to close for 5 years, you know, you did it in 2 weeks. And that's because there was no attention. She missed the connection between the bite and the rest of the body, and how
Right.
this guy, you know, just tell us more about that case, please. How did you evaluate, and why did you decide to do what you do?
Well, let me step back just a little bit, because I want to do is I want to talk about kind of the big picture and the biomechanics of the body, especially the mechanics of how the neck relates to the jaw. We know that if our neck is not in the right place, then the jaw is going to follow. And it always starts with the foundation of, you know, of the spine. In fact, that's pretty much how the rest of the body works. The airway is also dependent on the alignment of the cervical spine. We know that as well. For example, and this is one of the things that we show patients, and it's a really quick sample. What you can do right now, actually do this with me, is bite your teeth down right now in the position that you're in. Good. And then what I want you to do is just memorize where your teeth connected. And then relax your jaw, and I want you to look all the way up as far as you can and bite your teeth down again with your jaw relaxed. Do you see how that changed?
Oh, yeah. It's
And
retracting.
And then it's definitely retracting. And then put your head down, relax your jaw, and bite down again.
No,
and
my
you can
front
see
teeth did.
you can see how that changed as well. So what we're proving and showing is that the alignment of the neck dictates the alignment of the jaw and how the jaw actually functions within that realm, so to speak. So it's important that we do take X-rays and we do a full analysis on the alignment, looking at the neck from straight, making sure that things are lined up correctly. The occiput sitting on top of C1, and C1 is also in the right place. C1 is that very first bone that's right underneath the skull. And then looking at a person from the side and making sure that that person has a normal curvature in the neck. If that curvature is not there, then what happens is the head moves forward. Typically, we get that anterior head posture, where nowadays we call it tech neck, right? Where we're seeing people all the time with their heads down and looking at their phone. This is going to help perpetuate the problem. But when the head is forward like that, or people stay forward like that, what happens is it can also create jaw issues, or it can set that person up later. Even though their jaw doesn't hurt, it can set them up for a problem in the future. And so, yeah, 100%. The alignment of the neck really creates the alignment of the jaw. And so that's one of the first things we look at. Number one is checking that alignment. Number two is we also look at the movement of the mandible. And so we want to look at lateral movement each side. And we know if we compare, the midline of the teeth above and below, and we measure that midline out with a measuring tool, we should have about 10 millimeters of travel from left to right and equal on each side. We know that if that's not equal, then there's going to be a TMD problem, temporomandibular dysfunction issue. And so that's another part of the assessment as well when we specifically look at the jaw. Also, protrusion of the mandible is another thing that we look at. And then opening the mandible. So we should have about 40 millimeters of clearance when we open as well. And so when we put all of those factors together and we look at the system mechanically, then we can actually make changes to what's going on. On top of that, we're able to look at the jaw muscles, inside, outside, temporalis, all the muscles underneath, and we're able to do that type of work as well as needed per case, so to speak. So it really helps us to be able to help an oral care provider such as yourself to really get a full picture of taking care of that patient.
That patient, yeah.
Yeah.
Unfortunately, a lot of research in TMD, in airway, in sleep apnea, in epigenetics is showing us that people in modern society often suffer from malocclusion. And that comes with modern diet, modern lifestyle, not, having allergies since early childhood, that really changes the shape of the maxilla because it changes their tongue posture. So if that big, strong muscle is not seated in the roof of the mouth to provide a template for the shape of the maxilla narrows, and then the mandible that just follows, the mandible can be shifted backwards, which gives the patient a deep 2, or we call it a class 2 bite. It's always perceived as kind of like an overbite, but what's happening is that those teeth are not bucked. It's actually the mandible that has retracted. But what makes the case more complicated is when the mandible shifts slightly to the right and left, and that can affect C2 alignment, and then the range of motion too. So they usually, what we see, and I take scans, to establish this. So we can see that the patient loses their range of motion going to the left. That's usually a sign that that mandible has rotated to the left and jammed into that space. So they usually have ear issues on that side. They feel fullness in the ear. They go to the ENT. They're like, no, there's nothing wrong with your ear or hearing. I think it's the jaw alignment. But every millimeter, in the jaw affects the body. And when you come to the teeth, it's every micron. We're looking at accuracy of the bite being about 40 microns, which is very little. And if that's thrown off, through the malalignment of the teeth, then it can affect the whole posture and alignment and start a cascade of issues for the patients. So the key is having, what I'm preaching is a multidisciplinary approach to care, having different professionals from different specialties come together and try to give this patient more of a holistic approach to care and take care of everything rather than just focusing on the small area. And I think that's the key to success of treatment, kind of like what you mentioned with your dreams,
lifestyle,
like a treatment philosophy.
Yeah, that's why I like referring to you. I mean, I really don't know any other dentist that also evaluates posture. I mean, that when I found that out, just I was just like, wow, she gets it. So, and you're looking at the big picture, right? Not just the microscopic jaw stuff. You understand that there's other parts of the body that are going to affect the jaw, and and it could start from the feet, right?
Yes. It can be ascending or descending. Yes, it can. You can have a short leg and then end up with having a malalignment in your jaw because it's an ascending problem. And airway. I think the most two important things that dentists need to pay attention is posture and airway. Airway, unfortunately, is compromised in modern societies, and people will adjust to open up their airway. So you might be adjusting a neck forever to give that curvature to the neck, but if that patient's airway is compromised, they will always compensate for that and have that forward head posture, unless we do, we look at their sleep pattern and maybe help them with opening the airway. Basically, that gets into the orthopedics of the head and neck again. And before our surgeons and orthodontists, they have been doing these services surgically, widening the palate or sectioning the mandible, bringing it forward to open up the airway. But these days, with epigenetics and bioremodeling, basically what we call functional orthodontics, we can achieve the same results in non-surgically. It just takes a little bit longer. Instead of having surgery for one day, it usually takes about 12 months to do some bioremodeling. But I think long term, it's better for the patient because then they can establish good swallowing pattern, and just maintain this system. A lot of ortho cases that I see fail, orthodontist does a great job in establishing the occlusion, but the patient doesn't have the correct tongue posture to support that. And they're still mouth breathers. So after a few years, they're like, oh, my teeth are crowded again. They don't realize it's the teeth moving. It's the jaw, shrinking. And so
we didn't fix the problem. It was just treatment of the symptoms, really.
Exactly, treatment of the symptoms. So I really, go ahead.
Oh, I was going to say, I love I love how you guys are also doing sleep studies as well at your office. That's huge.
Yes, sleep study is so easy these days, you know, especially after this pandemic. The sleep companies that we work with, they came up with disposable sleep tests for us. So it takes,
Hmm.
you know, just a few $100s to walk from our office to your house with a home sleep test that is connected to our sleep physician through an app, you know, and you can get the results in a couple of days, read by a board certified physician. And then once we have those results in our hand, we know what to do. We used to lend our equipment to our patients, or patients used to make appointments at the hospital, go through co-pays. You know, it gets expensive to have a nurse watch you all night, you know,
Absolutely.
and most of them would say, oh, this is not right because I didn't sleep well. I was not in my own bed. This is not my
Right.
results. Most of them didn't even believe the results.
I hear that
And
all the time.
so nowadays, I mean, a lot of our new patients just walk out of our office with a home sleep test, and it's like an Apple Watch, you know, and a heart monitor and an oximeter, and the results just get delivered to us through the app the next day, and they can
Brilliant.
throw that away. It's just so easy, and I think every dentist, you know, as dentists, we get to see patients every 6 months at least because they come for their cleaning. How often do patients see their physicians? Not that often, only if they're sick,
It's
or,
not
you
that
know,
often.
a lot of people don't
Yeah.
go for their annual checkup. So that's why I
True.
like to spread the word to dentists and say, you are looking at all these signs and symptoms are right in front of you. You need to start paying attention to them and make a change in these people's lives because we see them so often.
Yeah, it takes a lot of work and it takes a lot of effort. And that says a lot about you as a doctor, as a physician. I mean, you're willing to put the time and the effort into it. I mean, I'm blown away by your office and the equipment that you have and what you do. I really am.
Thank you.
So thank you for taking care of our community. We've got an amazing community, and we need great, you know, providers like you. So yeah.
Thank you. The feeling is mutual, you know, and I'm sure we're going to impact a lot of lives, you know. Too bad I just got to meet you, you know. You've been here in Portland for a few years, and I just got to meet you through one of our mutual patients. So can't wait to learn more about your approach and refer more patients to you.
Absolutely. I'm the same. And I was going to say, it's never too late. So, it's never too late. So thank you.
You're welcome. What is what's an advice that you have for our patients? You know, a lot of people are at home during this pandemic, you know, and now unfortunately with the fires and air quality, a lot of people are stuck at home. And it's not good for, you know, what is one recommendation that you have for them that they can do at home?
That's a great question. So recommendation number one is going to be revolving around mask usage. A lot of people are using masks, and those masks are obviously over our nose, over our faces, and underneath their jaws. And a lot of times what I see people doing is they'll change the direction of their mask, you know, to move it, but they're using their jaw to do that. So they're protruding their jaw, or they're moving it from side to side. And I think if you just use your fingers, your thumbs on both sides, and just alter that mask to make it in a better place, rather than using your jaw to do that, I think that would be certainly number one. Number two is we're on the computer all the time, so we're even on our phone. So make sure that your workstation is set up the right way. Make sure the ergonomics are correct, and that, you know, if your computer screen is too far away, you're going to be leaning forward. Your head's going to be forward for hours at a time, and that's going to put a tremendous amount of pressure not only on your spine and nervous system, but also on that jaw. And if your computer screen is too low, it's going to create those same problems as well. So we want to make sure that computer screen is literally right in front of us, and the rest of your ergonomics are set up. The Optometrist Society recommends 14 to 17 inches between your eyes and the computer screen. So a good cheat is to put your hand up and touch your computer screen.
Oh, I see.
And that's roughly 14 to 17. So it's a good cheat to just use your arm and make sure that your computer screens are close enough. But those would be I know you asked for one tip. Those would be my top two tips. in
How
relation
about
to
some
making sure that
exercise
the
snacks?
jaws.
Can you give us some exercise snacks? Because 4 hours can go by so quickly when you're sitting at your computer. What do you want people to kind of like get up, move around? Just give us a few exercises that they can do quickly to either stretch or just relieve all that tension from their body.
I recommend whatever you do, make sure your I can't find my phone, but make sure your phone is on your desk, and you can program your phone to give you a break, right? And just make it really simple. Every 30 minutes or even 45 minutes, put a timer on your phone. When it goes off, finish your task that you're doing, maybe for the next minute or whatever, you're reading an email or writing an email, and then get up and get off your desk. That's going to be number one. Big thing that we can do as far as exercise is concerned is with the head forward. What we can do instead of, what's the opposite of this? The opposite of that is this. So making sure that we're actually looking up, because this is going to be the opposite of looking down. So we have to reverse the lifestyle. That's really important. Also, when we're sitting, we're literally sitting in this position, correct? So what's the opposite of this? It's going to be this. So not only are you going to be looking up with your neck and stretching, you can do a good 20-second stretch, but you also want to stand up, get up out of your chair, and bend backwards as well. Now, obviously, if there's pain or issues or problems, you want to see a qualified professional to check that and take a look. But those would be the two main things that you can do at home. The key is to take breaks and always be diligent about taking those breaks. And if you don't set a timer, it's not going to happen. I always tell my patients, if you don't schedule it, whatever's important in your life, you have to schedule it. Whether it's those yoga classes, whatever it is, time off, date night, an appointment with the dentist. It doesn't matter. It has to be scheduled. So number one is putting that in your phone and making sure that it's scheduled, so to speak. So that's the most important.
That's absolutely right, because 4 or 5 hours can just fly by. And I have a lot of patients that work for Nike, for Intel. They're like, I even work harder than before because I'm in front of Zoom all day long, and they work 8 or 9 hours in front of that Zoom. So just taking just a 1 minute break, after 1 hour, just taking 1 or 2 minute break is going to make a big difference.
It's
and
huge.
Not only in their posture, but probably in their blood pressure, in their diabetes, because it really changes the hormones too in our body.
Without a doubt.
Yeah.
You got to move. The body's not designed to be stationary. The body's designed for movement. And so you must move. So that's key.
That was very good advice, doctor. And, I really appreciate you coming on board with us, and I can't wait to see more lives change in front of us, just like what I saw, and I was just really impressed with the work that you did for that young man, and he's off to college with a much better alignment. What really concerned me is that he told me at age about 17 or 18, he was put on ADD medication. And, that concerns me because a lot of times the neck posture can affect the airway. And I wonder if he has an, undiagnosed sleep apnea. So I brought that up to his parents, and we're checking that even though he's gone. But it's just, just sitting back and looking at the patient as a whole is much more important than having those magnifying glasses on and just looking at teeth. I'm encouraging doctors most dentists that they're not tooth doctors, they're not tooth mechanics. They need to be head and neck doctors and pay attention to what our physicians are not basically paying attention or not get the chance to see their patients. Physicians don't see a healthy patient for 4 or 5 years in a row, but dentists see them, and I really want dentists to pay attention to these details.
Yeah, that's smart. That's what we need to do, is take those blinders off and look at the big picture. So yeah.
Well, I know you have a busy schedule. Thank you so much for joining us today.
You're welcome, Doc. Thank you so much for having me.
Thank you.
It's been awesome jumping on.